Pradesh Public Service Commission. We are looking at the paper Madhya Pradesh Public Service Commission Homeopathic Medical Officer Examination. This particular examination was conducted on the 25th September 2022. And this is part 2. We have already dealt part 1, which was serial number 1 to 50. Now this part 2 is going to deal with question number 51 to 100. These are the questions and we are going to take up them one by one. So friends, let us go to the first question. This question belongs to case taking and repertory. Case taking and repertorization. So homeopathy is blank space. Homeopathy is the of Dr. Jawahar Shah. He gives the variable 1 or variable A, heart, brainchild, both A and B, and C, none of above. So homeopathy is heart of Jawahar Shah or brainchild of Jawahar Shah. So it doesn't look like a very nicely framed question. It is a very poor question. I have no hesitation to say it is a very poor question. Answer is B, brainchild. So Jawahar Shah is a pioneer in homeopathic software development and has to his credit the development of software homeopath, one of the major software programs used by the homeopath in 85 countries globally. Jawahar Shah MD Home, born in 1955, Mumbai, is homeopath. He graduated from CMPH Medical College in 1976. He is a seasoned classical homeopath and has been practicing homeopathy more than 30 years. So his brainchild is software homeopath. So the question should have been framed like homeopath. The software in homeopathy is the brainchild of Jawahar Shah. So this looks like an ambiguous question. Anyway, now we go to the next. Dislocation rubric is given in which chapter of the Boarding Hassan's Therapeutic Pocket Book? Boarding Hassan's Therapeutic Pocket Book. So we have following choices. Choice A is joint, B is sensations, C is extremity, and D stands for all of above. The answer is B, sensations. And let us go for recall. So this is the page number 155. We are looking into the page number of Boarding Hassan's Therapeutic Pocket Book. And here is the dislocation. You can see the drugs. And then we have the second rubric, dislocation easy. Distortion of limb is the third important rubric here. Is it visible? Is it visible? Is it visible to all? Okay, now we go to the pathology. This question comes from the pathology. In allergic reaction, which cells have IgE surface receptors? Immunoglobulin G, E receptors, A, eosinophils, B, basophils, C, neutrophils, and D stands for monocytes. Friends, the answer is B, basophils. Let us go to the recall. Immunoglobulin E is a type of antibody that has been found only in mammals. And IgE is synthesized by the plasma cells. It has an essential role in type 1 hypersensitive reaction, which manifests in various allergic diseases such as allergic asthma, sinusitis, allergic rhinitis. It is capable of triggering anaphylaxis, one of the most rapid and severe immunological reactions. Anaphylactic reaction is a fatal reaction unless and until it becomes a medical emergency whenever it happens. So there is a swelling in your larynx, in your throat region, and you choke to death. IgE primes the IgE mediated allergic response by building up Fc receptors found on the surface of mast cells and basophils. Fc receptors are also found on the eosinophils, monocytes, macrophages, and platelets in humans. We'll go to question number 54. A repertory of comparative materia medica, USA, page 144, was written by Repertory of Comparative Materia Medica, USA, having total pages 144, was written by Dr. H.C. Allen, Dr. Lippi, Dr. Herring, Dr. Siffer. The answer is Dr. Lippi. And we have references here, and that comes from Essentials or Repertorization, 5th edition, Dr. S.K. Tiwari, and 1854, a repertory of comparative materia medica was written by Lippi, having 144 pages, USA. And there is one more repertory by English homeopaths, 600 pages, which was written by Siffer. So there are two people who have written two different repertories, but Lippi has written the repertory of comparative materia medica. Materia medica, we have the question number 55. The remedy for body having filthy smell even after bathing. The remedy for having filthy body smell even after bathing, we have number 1, variable Soranum. Second is Lilium tigrinum. C is Lac caninum, and D is Cicuta virosa. So friends, the answer is A, Soranum, and we have picked up our answer from Allen's keynote. And this is the navigational page where it shows at what particular point you will find this line. Because what happens, this text is a bizarre text. It is not written in a systematic manner. Like Hahnemann schema, you have mind, head, vertigo, other things. So it doesn't follow any schema. So where the symptom is written, it is very difficult to predict. So if you keep on reading this particular book, you have your photogenic memory, which gives you the idea of where you have to look this particular line in Allen's keynote. And so I have given especially this picture, and then the text which is readable here is, there are two lines, sentences, number 1 sentence which is before this particular line, and after that these two sentences are also been given here. So in between these two sentences, we have the body has a filthy smell even after bathing. So let us go to next question. This question belongs to case taking and repertory. Question number 56. Rubric torticollis is given in which chapter of Kent repertory? We have medieval external throat. B is back. C stands for throat and D stands for generalities. The answer is A, external throat. So let us recall, we go to the Kent repertory, we go to external throat, page number 475, and we are looking at the rubric torticollis. We have 3 major drugs which are in the first grade Lectinanthus, Lyco, Phosphorus. Second grade remedies are Calcarea, Causticum, Colchicum, Cuprum, Graphites, and this is Hyoscyamus, and Nux vomica and Rustox. Anyway, Delcamara is also coming up here. Caulophyllum is also there. Chin drawn to sternum, that is Cannabis sativa. Drawn to right side is Cuprum, Lectinanthus, Lyco, and it is drawn to left side, it is Lycopodium and Phosphorus. So we go to case taking and reporting. Question number 57. We have space developed his first repertory of the Antisori. So here, fill in the blank. Suggestion is variable A, Boni Hassan, Dr. J.T. Kent, Dr. H.C. Allen, Dr. C. Binder. And the answer is Boni Hassan. So, repertory of the antisoric remedy is compiled by Dr. Baron Clement Marc Maria Franz von Boninghausen, published in 1832, and Munster, and second edition in 1833. As this is the first homeopathic repertory in the field of homeopathy, which honored Boninghausen as a father of the repertory. We go to the next question, which belongs to case taking and repertory. Question number 58. Which of the following group of drugs is used to cure ravenous hunger immediately after eating? Ravenous hunger immediately after eating. We have variables A, Medorinum, Cinna, Lycopodium, and Sorinum. B, Cinna, Lycopodium, Sorinum, and Nux vomica. C, we have the group of remedies, Medorinum, Cinna, Lycopodium, and Nux vomica. And D is there, which suggests Cinna, Lycopodium, Sorinum, and aloes. The answer is A, Medorinum, Cinna, Lycopodium, and Sorinum. Let us go and see the text. We go to the Kent repertory. Stomach, appetite, ravenous eating after soon. We have the important remedies. Medorinum is in second grade. Cinna is in the first grade. Lycopodium is also in the first grade. And Sorinum is second grade representation here. We go to the PSM. Question number 59. Which method is used in the rural community in India for disposal of refuse? We have A, manure pit, burial, dumping, and incineration. The answer is A, manure pit. This method of refuse disposal is effective and relatively simple in rural communities. Most household waste in the rural area is organic with little inorganic material, and it is non-toxic. The garbage, cattle dung, straw, and leaves should be dumped into the manure pit. In 5 to 6 months' time, the refuse is converted into manure which can be returned to the fields. This information is coming from Park and Park, 23rd edition, page number 755. Ops. Question number 60. The most common side effect of intrauterine device insertion is A, bleeding, B, pain, C, pelvic infection, and D is ectopic pregnancy. Most common side effect of intrauterine device insertion is A, bleeding, B, pain, C, pelvic infection, and D stands for ectopic gestation. So answer is A, bleeding, and we are going to have the reference. The most common side effect of IUD insertion is irregular bleeding, for several months. And this is the site from where this information has been collected. Now, the next question is coming from FMT, and this question is 61, serial number 61. In which year was the Medical Termination of Pregnancy Act passed by the Indian Parliament? In which year was the Medical Termination Act of Pregnancy was passed in Indian Parliament? We have 1972 suggestion A, B is 1971, and C is 1982. D stands here for 1989. The answer is B, 1971. MTP Act 1971. The Medical Termination of Pregnancy Act 1971. Act number 34 of 1971, 10th August 1971. An act to provide for the termination of certain pregnancies by the registered medical practitioner and for the matters connected herewith or incidental thereto, be it enacted by the Parliament in the 22nd year of the Republic of India as follows. Short title and extent and commencement. This act may be called the Medical Termination of the Pregnancy Act 1971. It extends to the whole of the India except the state of Jammu and Kashmir. Please remember, it extends to the whole of the India except the state of Jammu and Kashmir. It shall come into force on such date as the central government may, by notification in the office of Gazette, appoint. We have next question, question number 62. It belongs to PSM. The percentage of available chlorine in bleaching powder is. The percentage of available chlorine in the bleaching powder is 30%, 33%, 43%, and 45%. The answer is 33%. The percentage of available chlorine in commercial samples of bleaching powder is usually between 33 to 38%. And this is the place from where this particular information has been gathered. Listen, we belong to now go to question number 63. Silent epidemic of the century is. Silent epidemic of the century is A. Coronary artery disease, B. Chronic liver disease, C. Chronic obstructive lung disease, and D stands for Alzheimer's disease. Okay. The answer is D. Alzheimer's disease. So Alzheimer's disease is the most common cause of dementia in elderly. It is characterized by progressive, global, and strong cognitive decline leading to an emotional distress and codependence. The number of Alzheimer's disease patients have been rapidly growing worldwide, increased by 117% in the last 26 years. The information in this report may help Alzheimer's disease disabled persons and their families by becoming more responsive to what has been called the silent epidemic, but which is no longer silent today. According to the National Alzheimer Association, Alzheimer's disease describe it as an epidemic of the 21st century. Again in PSM, we go to the question number 64. The most common cause of infant mortality rate in India: A. Fetal growth retardation, B. Diarrhea, C for respiratory infection, and D for congenital malformation. Answer is A. Fetal growth retardation. It will require additionally a current data, which probably I don't have the current data. The major cause of the infant mortality in India as per sample register system report on 2010-13 are prematurity and low birth weight, 35%, 35.9%, pneumonia 16.9%, birth asphyxia 9.9%, other non-communicable diseases 7.9%. So diarrheal diseases you will find 6.7%, known or ill-defined causes 4.6 to 50. And this information is on 15th June 2022. So anyway, the prematurity and low birth weight is leading all the causes. So it is the major cause contributing to mortality rate in infants. Friends, let us go to the PSM question number 65. Obesity is classified for a person when BMI is more than 30, B 35, C more than 25, and D is more than 22. The answer is A, where BMI should be more than 30. Obesity is expressed in the terms of BMI, grades of obesity. We have 0 grade means there is normal, no obesity. BMI should be 19 to 25. Grade 1 obesity is BMI 26 to 29, simple overweight. Grade 2 obesity is 30 to 39, and grade 3 obesity beyond 40 BMI, it is a severe obesity. We go to the question number 67. In the remodeling phase of bone, if fracture ends are accurately opposed and rigidly fixed, the callus formation is variable A, maximum and secondary healing occurs. B, minimum and primary healing occurs. C, primary and secondary healing occurs. And D, no callus formation. The answer is B, minimum and primary healing occurs. And the information comes from primary bone healing is the re-establishment of the cortex without formation of a callus. Primary bone healing is re-establishment of the cortex without the formation of callus. It occurs if the fracture is adequately fixed through reduction, immobilization, and rehab.
Sir, your mic has been muted. We can't hear you. Sir, you'll have to unmute again.
Audible?
Yes, sir, audible.
बहुत देर से ऑडिबल नहीं था क्या? अभी हुआ?
अभी हुआ था, अनम्यूट हुआ था, पहले तो ठीक
पता नहीं कैसे हो गया होगा. So we are going to a question number 68. It belongs to surgery. And left foot fracture are traditionally classified as left foot 1, 2, 3 and are related to Number 1, or you can say A, lower limb, B is pelvis, C is facial skeleton, and D is none of the above. And the answer is C, facial skeleton. So let us recall, left foot injuries are complex fractures of the midface, named after Rene Lefort, who studied cadaver skulls that were subjected to blunt force trauma. These fractures are classified into 3 distinct groups based on the direction of the fracture: horizontal, pyramidal, and transverse. So we have Lefort 1, this particular upper jaw is broken here, and then Lefort 2, you can say the nasal bones are also involved here to half extent, and in Lefort 3 we have the maxilla is involved, and this bone is zygoma and nasal bridge. Nasal bones, zygoma and maxilla. Upper jaw is maxilla. So in Lefort 1, we have only maxilla involved. Lefort 2, we have maxilla as well as the nasal bones are involved. And in Lefort 3, we have got not only maxilla, nasal bones, but zygoma is also involved. This type of Lefort fracture is determined by which regions are mobile. Lefort 1, mobility of the maxilla. Maxilla is free from the rest of the facial bones. Lefort 2, mobility of the maxilla and nose as a combined segment. And Lefort 3, you will find mobilized segment to they are including maxilla, nasal bones, and zygoma. So friends, let us go to the next question, which is question number 69. It belongs to surgery or pathology. Probably both can be there. Asepsis wound scoring takes all of the following into consideration except. Asepsis wound scoring takes all the following into consideration except: A, wound swab from the site; B, serous discharge; C, erythema; D, induration. And we have the answer is D, induration. So asepsis is a method of wound scoring which grades wounds into the uninfected, disturbed healing, minor infection, moderate infection, and severe infection. So wound scaring are having grades: uninfected, disturbed healing, minor infection, moderate infection, and severe infection. Asepsis scores have been proven to be both objective and repeatable. So interpretation of aseptic score, the minimum score is 0 and maximum is 70. Asepsis score 0 to 10, satisfactory healing, indicates satisfactory healing. 11 to 20, disturbed healing. 21 to 30 tells minor wound infection. 31 to 40, moderate wound infection, and beyond 40, wound infection. We'll go to the question number 70. The medical indications for circumcision are. The medical indication for circumcision are: A, phimosis; B, recurrent melanoprosthitis; C, recurrent urinary tract infection; D, all of above. The answer is D, all of above. Relative indication for circumcision includes: A, paraphimosis, melanoprosthitis and melanitis; pupital pearls and redundant foreskin; phimosis; prevention of sexually transmitted infection; prevention of penile cancer, prevention of urinary tract infection in boys with urological abnormalities, and trauma. So these are the condition, and out of 4 variable, all of above are correct choice. Let us go to the question number 71 of expectant management policy for placenta previa have been advocated by. Expectant management policy for placenta previa has been advocated by A. McFree and Johnson, Caldwell, Molloy, Steen, Leventhal, and Sheehan. We have 4 variables. Answer is A. McFree and Johnson in 1945. We have different stages of placenta previa here. Low-lying placenta, marginalized placenta, partial placenta, and complete previa. McFree and Johnson regime in 1945, expectant management aims to continue pregnancy for fetal maturity without compromising maternal safety in a center where there is a facility for cesarean delivery and blood bank. We have here the question number 72. Hingorani sign is the diagnostic for A. Urinary tract infection, B. Impacted pelvis, C. Gravid uterus and ovarian tumor, D. All of above. Answer is C. Gravid uterus and ovarian tumor. In case of ovarian tumor, abdominal excavation reveals the cystic swelling felt separated from the gravid uterus. In later months of pregnancy, confusion may arise. The patient is examined vaginally in head-down Tendenberg position to elicit groove between the two swellings, gravid uterus and ovarian tumor. This is the Hingorani sign. We have question number 73. Dangers of versions are A. Increased chance of fetal bleed. A is increased chance of fetal-maternal bleed. B is premature onset of labor. C is amniotic fluid embolism. And D is all of above. Dangers of version are. Answer is B. Premature onset of labor. Following complications can occur with external cephalic version: preterm rupture of membrane, changes in the fetus heart rate, placental abruption, preterm labor. So this is the diagrammatic representation of external cephalic version. We have external cephalic version, sometimes called ECV or EV, is a procedure healthcare provider will use to rotate the baby from breech position to head down position. The breech position is when the baby's feet or buttocks present first or horizontally across the uterus, called transverse lie. ECV is performed to conduct an vaginal delivery if baby is in breech position. External cephalic version rotates the baby to the head down position. This is the preferred position for a vaginal birth. We go to the question number 74. In which age of gestational pregnancy does the amount of amniotic fluid reach its peak of 1 liter? In which age of gestational pregnancy does the amount of amniotic fluid reaches peak of 1 liter? We have variables A, 32 to 34 weeks, 36 to 38 weeks, 42 to 44 weeks, and 44 to 46 weeks. The answer is B, 36 to 38 weeks. Amniotic fluid is reached to related to gestational age. It measures about 50 ml at 12 weeks, 400 ml at 20 weeks, and reaches its peak of 1 liter at 36 to 38 weeks. Thereafter, the amount diminishes till at term it is measured about 600 to 800 ml. As the pregnancy continues post-term, further reduction occurs to the extent of about 200 ml at 43 weeks. We go to the question number 75. It belongs to the subject of medicine. In which of the following conditions Babinski sign is positive? In which of the following conditions? In which of the following conditions the Babinski's sign is positive? Variable A is lower motor neuron lesion.
Please
Variable
mute
B is
everyone. Please mute.
variable B is upper motor neuron lesion. Variable C is Alzheimer's disease. And variable D is Parkinson's disease. The answer is B, upper motor neuron lesion. There are two diagrams. Diagram A is going to show us this is a plantar flexor and this is plantar extensor. B diagram. The upper motor neuron lesion is it is the pathology which involves the cerebral cortex, brainstem, or spinal cord. It means from the brain we have the motor cortex, corona radiata. Then we have in the midbrain the corticospinal tracts which go down, and in the spinal cord, lateral corticospinal tracts. They can get affected anywhere. In the brainstem, they are present in the crura. In the midbrain, they are present in the crura, anterior part of midbrain. And in pyramid, they get decussation. And by decussation, 20% fibers, they remain in the anterior aspect of the spinal cord, and 20% remain anterior and 80% are placed on the lateral white column. And the upper motor neuron lesion is characterized by increase in muscle tone like spasticity, hyperreflexia, means whenever you go for DTRs, reflexes are exaggerated. The persistence or reappearance of primitive reflexes like plantar extensor, such as plantar extensor response, Babinski is positive. When the baby is born, it shows this particular response, but when the baby starts moving, this response becomes different, and that is plantar flexor. We go to the question number 76. Adhesiveness, aggregation, agglutination are the properties of red blood cells, white blood cells, platelets, all of the above. The answer is C, platelets. Platelets or thrombocytes are formed elements of blood. These are small colorless non-nucleated bodies. It ranges from 2 lakh to 4 lakhs. Properties: platelets have three important properties. A, adhesiveness, property of sticking to a round surface. During injury to a blood vessel, endothelium is damaged and subendothelial collagen is exposed. While coming in contact with the collagen, platelets are activated and adhere to the collagen. Aggregation, you will find it is grouping of platelets. Adhesions follows by activation of the more number of platelets. During activation, platelets change their shape with elongation of the long filamentous pseudopodia, and agglutination is clumping together of platelets. We go to the question number 77. Which one of the following statement is correct regarding anti-astigmatism? Which one of the following statements is correct regarding astigmatism? Variable A, it is the condition characterized by the inability to see distant objects. B, it is the condition in which light rays are not brought to a sharp point upon retina. And variable C is, it is the condition in which the two eyes have unequal reflective power. And variable D stands here, it is the condition characterized by inability to see near objects. The answer is B. It is the condition in which the two eyes have unequal refractory power. Astigmatism is caused by the cornea or lens that has different shape than normal. Astigmatism is very common. Other symptoms include vision is blurry at near and far because light rays either fall short of the retina or behind it. Blurry vision or areas of distorted vision are there. Eye strain and headache is common. Squinting to try to see clearly. And treatment includes astigmatism is corrected by the eyeglasses or contact lenses. Question number 78. Which one of the following hormone is not secreted by placenta? A, estrogen, B, oxytocin, C, relaxin, and D is HCG, human chorionic gonadotropin. The answer is B, oxytocin. The oxytocin is secreted by, here it is. It is a peptide hormone and neuropeptide normally produced by the hypothalamus and released by the posterior pituitary. It plays a role in social bonding, reproduction, childbirth, and the period after childbirth. This oxytocin is also known as cuddle hormone or love hormone. We have question number 79. It belongs to Organon. In which aphorism?
सर ये ऑर्गेनल नेक्स्ट उस पे शुरू कर ले अभी
हाँ ठीक है, नेक्स्ट कर लेते हैं। तो ये करीब करीब 20 क्वेश्चन रह जाएंगे इस क्वेश्चन पेपर के, तो हम नेक्स्ट
80 तक कर लीजिए, 81 से नेक्स्ट हो जाएगा।
ले लेंगे, इसको भी ले लेंगे, कोई खास बात नहीं है। नेक्स्ट टाइम ले लेते हैं इसको।
ठीक है, ऑर्गेनल कब शुरू हो रहा है ना, तो ऑर्गेनल
नेक्स्ट वो इकट्ठा ऑर्गेनल का चलता रहेगा।
हाँ जी हाँ जी।
चलो ठीक है फिर। और वापस चलते हैं यहाँ पर।
मैं
हाँ, वापस आ गए हम लोग।